The goal of any of these treatments or management strategies is usually to make the cat feel better or make the kidneys last longer. If you're new here, welcome! I'm Dr. Emily, and this channel is dedicated to helping you take the best care of your senior kitty. Make sure to hit that subscribe button so that you don't miss a thing, and like and share the videos so I can create more content like it. It seems like there is a never-ending list of treatments and management strategies for cats with chronic kidney disease. And the goal of any of these treatments or management strategies is usually to make the cat feel better or make the kidneys last longer. Well, because cats are obligate carnivores, there are specific amino acids that their body can't synthesize. So they have to get these amino acids in their diet. It has to come through specific sources of protein. This protein metabolism also comes with uremic toxins. So basically, the cat takes in the amino acid it needs, the body breaks it down, there's toxins, those get excreted. In a healthy cat, those uremic toxins get excreted through the kidneys. As you can imagine, a cat whose kidneys aren't working 100%, they don't get rid of these uremic toxins like they're supposed to. So they start to build up in the body and they make the cat not feel good. It becomes this balancing act between the needs of the body and how things are metabolized. At the time of this video, there's a newer supplement on the market called Porus One, and I'm getting a ton of questions around it. Mainly because there's confusion in that it's considered a binder, and the confusion is between phosphate binders, which address phosphorus levels in the body, versus this is a binder directed more towards that protein metabolism and the toxins that come with it. Porus One contains an ingredient called renal tech. It's basically a name given to the molecule itself that's in the packet by the company. It doesn't mean anything specific really unless you're familiar with the company. What it is though is a carbon-based binder. So it's these little spheres that have holes in them effectively that bind to molecules of opposite charges. According to the company, the surface area of all of these spheres within one package is the surface area equivalent to 3 tennis courts. That's a pretty big surface area, and it makes me a little optimistic this product does what it's supposed to. But here's some of the details. With Porus One, you mix this product into food. It goes through the intestinal system, so it's not broken down by stomach acid, and it's not absorbed by the body. And as it makes its way through, these little carbon spheres are designed to attract the toxin of protein metabolism, or those uremic toxins. So basically the goal is to keep these toxins in the GI tract so that they're excreted into the poop rather than going through the kidney. When the kidneys aren't working normally, obviously we want to avoid stressing them as much as we can, but we also want to decrease their workload. And by having these protein metabolites excreted in the feces, it never even touches the kidneys. One of the molecules that these little particles trap is called indoxyl sulfate. According to the company, these molecules aren't supposed to trap things like vitamins or cells or enzymes. It shouldn't bind bigger things. According to the company, the product should remain in the intestinal tract for about 12 to 36 hours. So the directions are to give your cat one packet once a day. It says to mix this packet with food, which on one hand can be a little bit problematic. So if you're going to try it, I would definitely recommend you mix it with something other than the food that you absolutely want your cat to be eating. We don't want to create any food aversions here. So now the company claims that it's pretty well accepted, meaning cats like it, but you don't want to risk turning your cat off to the food that they're doing really well with or that you want them to eat. So mix it with something totally different, give that first, and then give the food you want to feed. They do make a supplemental product to go with this called Add One. It looks like a little paste that you can mix this powder in. Your cat should eat that first, and then you feed them the regular food. A box comes with a 30-day supply, so basically 30 packets to last you one a day for 30 days, and it's available through veterinarians. The product itself is produced in Germany for Dechra. Dechra is the company that makes Porus One. It is recommended that you give it 2 hours after all other oral medications. What we don't know with 100% certainty is this product going to bind to other things? Meaning the majority of cats with kidney disease receive multiple different treatments or medications, We don't want to give them this and then have it absorb or attract a medication that we're trying to get through the body. So the current recommendation is to give it 2 hours after everything else. Because it's a supplement, there can be no direct claims of efficacy. Supplements also don't go through the rigorous testing required of drugs. So one of the problems with this product is there aren't a ton of studies on it. The company has done a study, there are a few floating around out there, and we're learning more about it as we go, but it is not something that is really well studied or as well studied as a drug would be. Indoxyl sulfate, that's not something we measure in our routine lab tests. So I can look at the data and say, yes, absolutely, in the studies, this molecule was trapped in this binder, it was excreted through the GI tract, it lowered these levels in the bloodstream, but this isn't something that we test in a regular veterinary office. So we're stuck with, is this really effective? Because it's not going to show up on a routine blood work. It's not like we're going to see a decrease in a BUN. We're basically left with, does the cat feel better? Is the cat doing better? And not that that's necessarily a bad thing, but there is a very, very large placebo effect when it comes to humans. Our cats don't necessarily have a placebo effect because they don't necessarily know what we're doing, but we as humans and caretakers may perceive things that are or aren't happening. So it is difficult to say, this cat received this once a day for 30 days. Are they truly doing better or not? Because we can't measure it in the bloodstream in our routine veterinary settings. Now, can it be seen in how the cat is doing? If it's working, sure, it should be seen in that, but it's just not that distinct, scientific way to measure this. As far as the company is concerned, Dechra has been a relatively reliable company in the veterinary space, so that doesn't worry me quite as much. So as far as Porus One as a product, what are the pros, what are the cons? Pros are that it seems like most cats will readily accept it. It does seem like some cats feel better when they're taking it, and it may actually decrease the workload of the kidneys. If it's doing what the claim is, that it's binding these protein metabolites in the GI tract and they're never even seeing the kidneys, it's definitely lessening that workload of the kidneys. So you basically get a two-for. The cat feels better and the kidneys don't have to do anything with this. As far as the cons to this product, again, it's a supplement, so the studies are limited. There is concern that it may bind other things. So it's not 100% guarantee that the only thing this is going to bind in the gut is those protein metabolites. In some cats, it's probably going to create a food aversion. We always have that cat, no matter what we put in their food, they're just never going to touch that food again. So you definitely have to be careful there. And it's very difficult in a clinical setting to confirm this is working. From my perspective, I would probably clump this into the category of it may help, it's probably not hurting, but you need to know what you are trying to use it for and what the limitations of the product may be. As questions come in regarding more management and treatment strategies, I'll continue to make these videos, but hopefully this one about Porus One answers some of those really basic questions as to whether or not it's a good fit for you and your cat.